Ever feel like you're just drowning in information when you try to grasp something important? Like you just want the key takeaways, right? The essential stuff.
Yeah, without wading through pages and pages.
Exactly. And that's what we do here. We do the deep dive for you, trying to pull out those core insights.
And today we're diving into something really crucial in healthcare, but maybe something that flies under the radar a bit. It's the administrative hurdles facing rheumatologists.
Right.
We've got some material here that really lays out these challenges and, maybe more importantly, looks at how outsourcing might offer some real solutions.
Yeah. So our mission for this deep dive is pretty clear. Figure out what those big admin roadblocks are for rheumatologists day to day, and explore how offloading some tasks could genuinely help them and, by extension, their patients.
Hopefully leading to some of those aha
Yeah.
moments about healthcare efficiency.
Definitely. Let's jump right in then. What are we seeing as the biggest administrative headaches for rheumatologists right now?
Well, probably the biggest thing coming through in the sources is just the sheer amount of admin work. It really pulls rheumatologists away from actual patient care.
Okay.
And a prime example is prior authorizations, getting approval for medications.
Yeah, I've heard that can be tough, especially for certain types.
Exactly. Particularly for the biologics and other expensive therapies, the ones used for complex conditions like vasculitis or rheumatoid arthritis,
The
lupus.
histamines conditions, yeah. And those meds can be life-changing. So what makes the authorization process such a barrier?
Well, it's often incredibly involved. You need heaps of documentation, specific reasons why this drug, lots of back and forth with insurance companies. It's a lot.
Wow.
And
Yeah.
often these are the most effective drugs for these diseases. So any delay in getting that okay
Yeah.
can really slow down getting patients the treatment they need. It can actually impact their health.
That's a critical point. Just imagine needing that specific medication, for something really debilitating, and then hitting these delays just for paperwork. It's more than just annoying. It sounds like it could affect how the disease progresses.
It absolutely can.
And it's not just the medications, is it? I imagine verifying insurance is another big time sink.
That's right, yeah. The sources really point that out. Just confirming each patient's coverage for, well, everything, meds, tests, procedures. It takes a lot of effort.
Because every plan is different.
Exactly. It's not straightforward. Each insurance plan has its own rules, its own requirements. You need to know the details of that specific patient's coverage.
And mistakes happen, I assume.
Oh, definitely. Mistakes can lead to claims being denied,
Hmm.
patients getting unexpected bills, which then means more admin work for the practice trying to sort it all out.
You start to wonder how much time highly trained doctors and their staff are spending on, well, insurance paperwork instead of actual medicine.
It's kind of staggering when you think about it.
And then there's the basic running of the practice, right? Like keeping appointments organized, managing the money side, the revenue cycle.
Precisely. Efficient scheduling, making sure billing is accurate,
Yep.
chasing payments. It's all vital for keeping the practice afloat financially.
But errors there must cause headaches too.
Big ones. Lost income, unhappy patients if their bill's wrong, and just more admin time trying to fix mistakes.
When you look at the whole picture, these aren't just small annoyances. They're actively taking time away from patient care.
And that really is the core issue, isn't it? All this energy, all this time on admin, it's time not spent with patients, which seems especially important in rheumatology, dealing with these complex chronic conditions.
Absolutely. The sources we looked at really stress how vital that direct doctor-patient time is for managing things like vasculitis or autoimmune disorders effectively.
You need time to really understand what's going on with that specific person. Exactly. Time to listen to symptoms, track how the disease is progressing, adjust treatments. If you reduce the admin burden, you directly create more time for that crucial interaction.
Makes total sense. More face time means better understanding, better explanations of treatments, more collaboration on a care plan. It's not just writing a prescription.
No, it's about education, that whole holistic view of the patient's health. And, well, this is where outsourcing comes into the picture as a potential answer. Targeted outsourcing seems like it can tackle these specific bottlenecks we've been talking about. Like take prior authorization management, for instance.
Okay, yeah, let's dig into that. How would outsourcing prior authorizations work? It feels pretty tied to the clinical side.
Well, the idea is you hand off that whole process to specialized teams, people who, really understand the insurance requirements, the approval pathways for different companies.
So they know the system inside out.
Pretty much. They handle the calls, submit the paperwork correctly, follow up constantly, and basically work to get those approvals through quickly. It takes a huge weight off the rheumatologist and their office staff.
So instead of clinic staff spending hours on hold or filling forms, this external team just handles it. That sounds like a massive relief. What about verifying insurance? Can you outsource that too?
Definitely. Similar idea. You have dedicated teams whose whole job is to verify patient insurance details accurately and quickly. They figure out the coverage for treatments, tests, and sort of proactively deal with any potential issues.
Ah, so they catch problems before they cause delays or those dreaded surprise bills for patients.
Exactly. It leads to a much smoother process for everyone. Less stress, fewer holdups in getting care started.
That sounds like a win-win. Avoiding surprise bills is huge for patients, and I bet the clinic staff are happier not dealing with the fallout. What about the day-to-day stuff like scheduling?
Yes, even appointment scheduling can be streamlined through outsourcing. Specialized systems, maybe dedicated teams. They can optimize schedules to cut down wait times, balance the doctor's workload better, send out reminders to reduce no-shows,
Okay.
and just generally make the daily flow in the practice much smoother, less chaotic.
So it's creating more efficient operation overall, not just saving time on one task. And the money side, revenue cycle management.
Yeah, outsourcing that basically means letting experts handle the complexities of billing, claims, payments, and making sure everything complies with the regulations.
Which are always changing, I imagine.
Constantly. So having specialists manage that ensures the practice gets paid correctly and on time, minimizes billing errors, and stays compliant. It lets the rheumatologist focus on patients, not the nitty-gritty financial operations.
It's like bringing in specialized backup for all those essential non-medical tasks that keep a practice running. It sounds like the benefits go way beyond just saving time then.
Oh, for sure. The sources suggest that by giving rheumatologists more time for actual patient care, outsourcing can lead to, well, better patient outcomes.
Makes sense. More focused attention, better understanding.
Exactly. And better quality of care often follows. Plus, think about the doctors themselves. Reducing all that admin stress, the risk of burnout, it can seriously boost job satisfaction.
That's a huge point. We hear so much about physician burnout. If this helps ease some of that pressure, that's a massive plus.
It really is. A happier, less stressed doctor is probably going to provide better care, right?
Absolutely. And it sounds like this could ripple outwards, potentially benefiting the whole healthcare system.
That's the idea. If you make practices and specialties like rheumatology run more efficiently, it contributes to a more effective system overall. It's about letting experts focus on their actual expertise.
So for you listening, even if rheumatology isn't your area, this conversation, this deep dive, it really touches on something fundamental about healthcare efficiency. Tackling these hidden admin burdens, it really can improve the care you or your family might receive. It's making sure doctors have the bandwidth, the mental space to focus on healing.
That's the core message, really. These big administrative loads on rheumatologists, they can be tackled often through strategically outsourcing some of these non-clinical functions.
Right.
And that shift doesn't just free up time for patients. It genuinely seems to hold potential for better outcomes, happier doctors, and maybe a more efficient system overall.
So here's something to think about as you go about your day. Administrative tasks, these kinds of operational burdens, they exist in almost every specialized field, not just medicine. What could that mean more broadly? Could similar outsourcing approaches unlock efficiency elsewhere, letting experts in other fields truly focus on their core work? Maybe something worth pondering?